Every day, all over the globe, an estimated 350,000 babies are born. But for thousands of women in low-income countries, the sun setting and the loss of light can be the difference between life and death.
Every year, 300,000 mothers and more than 1 million newborns die from complications of pregnancy and childbirth. Maternal and newborn mortality are urgent global health problems. One of the factors that's most often overlooked for healthcare is electricity. Health workers need reliable electricity and bright lighting in order to provide life-saving care. The countries with the highest rates of maternal and newborn mortality are very often the same countries that are suffering from energy poverty or the lack of reliable modern electricity. COVID-19 has actually heightened the need for resilient health centers, and included is the need for reliable electricity. Health workers cannot be expected to provide life-saving care and to treat patients that may have a very contagious infection if they cannot see what they're doing.
In hundreds of thousands of health centers lacking reliable electricity, midwives and doctors struggle to provide critical care in near darkness, relying on candles, kerosene lanterns, and cell phones. Health workers are unable to detect life-threatening conditions or provide essential services. Emergency cesarean sections and other life-saving procedures are postponed or even canceled. The consequences are often tragic.
Hundreds of thousands of health centers across the globe lack reliable electricity. In fact, in some places, they have no power at all. About 99% of maternal deaths happen in low-income countries.
As an obstetrician, I know the importance of electricity. Health workers are impaired in trying to provide life-saving care, including conducting safe procedures, administering medications, starting intravenous lines, conducting surgeries, providing resuscitations on newborns. They are struggling trying to provide care for something that we consider a joyous event here in this country. Around the world, millions of women are struggling in near darkness to survive something that's so basic, giving birth.
No woman should have to die giving life.
We Care Solar is giving health workers the power to save lives. As one physician explained, we are witnessing what light means in communities where night means death to those in need of emergency care after the sun goes down.
As a doctor, I practiced for 7 years in facilities where having electricity at night was by begging. You imagine being in the middle of an operation and power goes off. It's very impossible to save what you cannot see. If you can see a mother, you can be able to understand what she's going through. You can take the right history. You can do adequate examination. You can take observations. And so you can even do a right delivery. So you put the mother at risk of death. You put the newborn at the risk of death.
Every woman has the right to a safe delivery. Every health center is entitled to reliable electricity. And renewable energy offers an immediate and sustainable solution to the global problem of energy deficiency in healthcare. Rooted in first-hand experience, We Care Solar was founded by a physician's empathy for health workers and their patients.
We Care Solar began in Nigeria trying to serve a few clinics. We now are a global nonprofit serving thousands of health centers, working country by country to ensure that every remote health center has reliable electricity and lighting to save lives in childbirth. We do this in partnership, working with health ministries, international NGOs, UN agencies, building an entire coalition to ensure that every health center can be equipped with life-saving electricity and light.
Basically, what we are trying to do is to ensure that these spaces and these health centers can have access to reliable electricity.
Clean energy solutions, such as We Care Solar suitcases for healthcare workers in remote areas, are helping to transform millions of lives.
The solar suitcase is improving life chances for women, for children, for families.
The solar suitcase pairs off-grid electricity with high-quality end appliances. It was designed to withstand heat, dirt, moisture, and impact. The solar suitcase comes with large solar panels for most installations, but the rest of the components, the battery, charge controller, all of the end appliance, and even the installation hardware fits inside the case, which allows it to be transported anywhere electricity is needed. The solar panels either come as 100 to 250 watt solar panels, or in cases of humanitarian disasters, we can prepare a solar suitcase that has foldable panels that fit within the case itself, allowing these to be transported anywhere they're needed.
As health departments around the world respond to the spread of COVID-19, facilities in low and middle-income countries struggle to maintain essential services, putting mothers and newborns at greater risk. The pandemic has heightened the need for light and power for both COVID-19 and many other services. To address this problem, We Care Solar is implementing country-level programs through its Light Every Birth initiative.
In Africa and over the world, access to electricity is a big challenge. And so the future of Light Every Birth is to support so many facilities in Africa and in the world to be able to bring the reliable light to that mother, that health worker, in that rural facility to be able to save their lives. The solar suitcase might look like a small thing, but has great impact in these facilities. It's able to provide light, allow communication, allow quality service to be delivered to these many, many mothers living in these facilities. So I call upon everybody to support this program. I would like to invite everyone to join us to show the world that we care.
To learn more, visit We Care Solar online at wecaresolar.org.